Hello, I'm Dr. Brent Gibson, and today I want to talk to you about peripheral neuropathy and having a goal for neuropathy treatment. So a lot of times people say they would love to have just be able to heal their peripheral neuropathy, and really the truth is, so far that's not an option. We haven't found anything that completely heals the problem and fixes it forever. There are things you can do to treat it. There are things you can do to make it better. So when you're setting up your goal, when you're trying to figure out what you're hoping to get from neuropathy management or neuropathy treatment, you need to be realistic and actually decide what that means. So the question is, in a perfect situation, you say, okay, if I could have the perfect situation with my peripheral neuropathy, I would have no pain, no problems, no limitations, then I'd be done. And that's what we're shooting for. That's what we're hoping for. But in a lot of cases, you may not get completely there. So the question is, what is the goal that you have? What are the things that you'd want to be able to do? If you said, okay, I can reduce my pain from 8 or 9 out of 10 to 1 or 2 out of 10, is that sufficient? Or if you say, okay, I want to be able to go on hikes with my grandkids, or I want to go play in the backyard with my kids, or I want to be able to get on the ground and play with the babies and so forth. All of those such things could be something you're doing. I had one patient, his goal was to be able to go watch his grandson play baseball. And as we improved his symptoms, he still had pain. He still had limitations, but he was able to get back to playing, or back to watching his son or his grandson play baseball. And that was the goal that he had. I have another one that her goal is to be able to go on walks with her children. And that's the goal that she's shooting for. And that's the goal she's going for. So what is your goal? What is that thing? Say, if I didn't have peripheral neuropathy, what is the one thing I'd be doing that I can't do right now? A lot of times that can be your goal. Say, okay, this is the thing I would be doing if I didn't have peripheral neuropathy. And set those goals and create a list of things that you're trying to get to, because then you can actually evaluate and say, yeah, I still have a little bit of pain, but because I'm able to do this, I've reached that extraordinary life that I consider that situations. And that's kind of what we're doing. So this is Dr. Brent Gibson, and this is your Neuropathy Nugget Day 231. What you can do, what should be the goal for your